My name is Bobby Burnett, and I live in Amelia County, and I am now a retired firefighter. I just retired this year. Well, in January, I was involved in a training accident, and I didn't think nothing of it at first. And then after about a month or two, I started experiencing a sharp pain in my back, around my neck area, and it rotated, radiating down into my shoulders. I noticed that when I would pick up stuff that I couldn't hold it. I had a weak grip strength, and I would drop things.
My name is Joshua Herzog. I am an orthopedic spine surgeon with Ortho Virginia and predominantly at Johnston-Willis Chippenham campus. Well, Johnston-Willis has a great name for spine surgery in general. There's been a lot of spine surgeons that have been there for a long time. Ortho Virginia did not have a spine surgeon co-located there, and so they asked me when I got out of the U.S. Army to come and join their practice at the Johnston-Willis campus, and I jumped at the opportunity.
My first visit when I went to see Dr. Herzog was great. His staff was fantastic. When I first sat down with him and we talked about my options, he kept coming back to the point that we need to repair this. This is something that we're not going to be able to do through PT. So the thought of having cervical spine surgery was scary. Am I going to be able to walk again? Am I going to be able to function? Am I going to have that normal life that I had, prior to my injury? So it was very frightening. But he sat down, we went through a step-by-step, and he explained to me the entire procedure and what the outcome was going to be.
Robert came into my clinic. I think it was about 8 months ago when he first saw me, or 7 months ago. And he was initially complaining about some right-sided arm pain that had been ongoing for him for many months, I think 5 or 6 months. And he had tried a number of different modalities already. He was complaining about pain that was coming down his entire arm. It was waking him up at night. He was getting less than 3 hours of sleep. He was in true misery. He was a fireman by trade and was unable to be working. But beyond that, he couldn't even hold a cup in the morning because his hand was so weak. He was dropping it. And he wasn't sleeping, and so it was just really playing with his mind. He was miserable. So we talked about doing a little surgery to go in there and take the pressure off the nerve through a little fusion.
The nursing staff there was great again also. She came in, she explained to me again. The big thing is they repeat it over and over and over to make sure that you understand what's going on. Any questions that you have, they're going to answer for you right away. They did really well about that. They kept me informed of exactly, how things were going to play out. My recovery on it has been excellent. I've went from basically almost a year of being in constant pain to where now I am pain-free. After about 2 months, I was released back to my normal lifestyle. So I've went from the things that I could not do to where I am back to being active in my normal life.
He really flew through the process and recovered splendidly. He woke up, he had no pain in his arm, he was already well on the road to recovery.
People that have come and talked to me about this at work, that have experienced the same problems that I have asked me, why did you pick Dr. Herzog? And why did you pick Johnston-Willis? And I tell them from the first time that I walked into his office and the rapport that I developed with him right away, and his staff made me feel like it's not just a organization where they're just going to run me through. I'm just not another patient to them. When I got to the hospital, again, I felt that they cared that I was there. Okay, they gave me that feeling that when I walked in, I wasn't just another patient that was just signing the log, signing the register, and walking in. They showed concern. They were quick to answer any question that I had, and they were very good to my family.
I have the same people reproducibly in my operating room, and what that creates is an environment where everybody knows their role, everybody knows their position, and it makes a system or production line that is clean, efficient, and safe. And so, real happy with the overall team that's there and the outcomes that we're generating at Johnston-Willis in the orthopedic spine world.
Working in the fire service, they always told you, treat people as you would treat your mother and or one of your loved ones, and that's exactly the way I was treated here.